Yo, what up? It's a tip of the week, and today we're going to discuss osseointegration of your implants.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
Alright, so I got this message from a doctor off of Instagram, and they were asking me about, hey doc, how do you determine if your implants are osseointegrated? Now, if you know anything about me, I am a minimalist. Not to the detriment of my staff, nor myself and the patient, but I just follow specific principles that's going to guide me to success. So if you're thinking I'm going to promote some big fancy equipment, I'm not. I'm going to give you some principles that are going to help you determine and give you best practice to know that your implant is integrated. All right, number one is this. Make sure your implant, if you're the one placing it, has at least 2 millimeters of bone circumferentially. Now, I know the big craze now is wanting to place immediate implants and just, all on four and all these wonderful things, but you still got to go back to the basics and your principles, guys. And if you're disregarding that, it doesn't matter what instrument you use, it's going to have a high likelihood of not integrating. So keep that in mind, that 2 millimeters around the bone, around the implant, all the way around, and get it in good, stable bone. Number two is this. You wait at least 4 to 6 months before you start doing any type of restorative work on it. And that goes for healing abutments, but it really just depends on where you are. Now, if you really got a very low torque values, then you really want to wait that 6 months. But if you got around the 50 and 60 mark, you have a good idea that your implant's probably going to be ready in about that 3.5, maybe 4 month mark to be able to load. Now, these times will change based upon if you're doing a case that had a significant amount of grafting. And I would definitely say you're going to have to make these determinations. And if you feel as if you need some of these fancy equipment, by all means. However, if you're like me and you want to choose biology, it's always best to give the patient time to heal. So if it's immediate implant, stretch it out. If you have high torque values, you're probably going to be able to shrink the amount of time it takes from placing that implant to actually restoring that implant. And then what I found in my career is that in my patients, if there's going to be a failure, it's going to happen a lot earlier on rather than later. And then for all my restorative docs, make sure that if you're going to use cement, be very judiciously on how you apply it. I believe I have a couple of videos about how to cement a crown effectively without getting it into the sulcus and really damaging things. And number three is this. Ensure that you have great keratinized tissue circumferentially around the implant. Guys, I can't tell you how many times there have been a great placement, bone all the way around, but there's no keratinized tissue. Now, I know that osseointegration is all about into the bone, but I want to take you a lot further and think about the soft tissue that's going to keep your implant that either you placed or that you're going to restore the safest and most protected. And so I really want you to remember keratinized tissue. Am I working in a non-keratinized zone? And if I am, I'm probably going to need a soft tissue graft that's going to be able to really ensure that your bone and your implant is well covered and nicely tucked away like I would my daughter, my young daughter. And so there you have it, guys. That's how I determine. This is a JW method on how I determine if my implants are integrated. So you're not gonna find me counter torquing, all that other stuff. No. If your implant's going to fail, it's gonna fail earlier than later. All right, guys, so there you have it. I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one. Oh, and by the way, guys, I love your comments. I want to know what tip is actually helping you and which one did you apply and change the whole way in which you practice. All right, guys, so I think I took a good amount of time away from you, and so I want you to make it a great one.